Hello, my name is Dr. Drew V. Moffitt.
And today we're going to be talking about, is COVID-19 worse than the common flu? Well, the answer is no and yes. In order to answer this question, we need to understand two epidemiological terms: the infection fatality rate and the R naught. So first of all, what is the infection fatality rate? Well, it is the percentage of all people infected with a pathogen that will die. It's calculated by dividing the total number of deaths by all people infected. Well, we have a pretty accurate accounting of the number of deaths. The problem is, in the middle of a pandemic, it is very hard to know the total number of people infected. This is because there can be a large group of people who are infected but have minimal or no symptoms. As a result, you can't just test the people that present to a doctor or a hospital. You need to test people who have no symptoms and then include them in the total number of people tested. Well, that means you would need to test the whole population, and that's just too many tests and would take way too much time. So in the middle of a pandemic, the only thing you can do is estimate that number. So this is how you do that. You calculate the percentage of people tested that are positive by taking the total number of positive tests and dividing that by all tests performed, and that gives you the percent positive of the people you've tested. Then you can calculate the total number of people infected in the population by multiplying the percent positive by the total population of the country, which is known. The larger the portion of the population that you've tested, the more accurate the estimate. So what does this look like? This is an important table, so let me take you through it. This row represents the total number of deaths in the population. This row represents the number of people infected. This row is the calculation of the infection fatality rate. You calculate this by taking the number of deaths and dividing it by the number of infected people. These columns represent different scenarios that we'll walk you through. Let's look at the first one. This is for the flu season of 2018 to 2019, or last year. Now, because this happened in the past, we have actual data to look at. On the CDC website, it lists that the total number of people who died was 34,200. They estimate that 35 million people were infected with the flu last year. That calculates out to an infection fatality rate of 0.098%. What that means, practically speaking, is that if you got the flu last year, there was a 99.9% probability you would survive that. Let's look at this year. Now, this year's not over, so we only have estimates, but if you go to the CDC website, you'll see these estimates. They are estimating that the total number of deaths this season will be somewhere between 24,000 to 62,000 people dying from the common flu. They estimate that the number infected is anywhere between 39 million to 56 million people. That calculates out to an infection fatality rate range between 0.062 and 0.111. Now let's look at this column. This is an important one. This is looking at data for COVID-19 this year, specifically in Iceland as of April the 14th. Now, why is Iceland important? Well, they're important because they, as of this date, had tested the largest proportion of their population. They had tested 10% of their total population. This is the data that we get from that. They had, as of that date, 8 deaths, and they estimated that they had 16,746 people infected. That comes out to an infection fatality rate of only 0.048%. Now let's look at this column. This is for South Korea. Now, South Korea has been in the news a lot because they had tested a lot of people. As of April the 9th, this is the data that they were showing. They had 204 deaths, and they were estimating that the total infected in the population was 494,000 711, with 1% of the population being tested. That calculates out to an infection fatality rate of only 0.041%. Now let's look at what we might be able to estimate for the United States experience with COVID-19. Now, on April the 16th, President Trump gave a news briefing. And in that briefing, he said that there had been 3,500,000 people tested. And if you go to the CDC website on that date, they were listing the total number of deaths as 34,641. The calculated number of people infected in the United States would be 64,139,802, with 1% of the population being tested. That calculates out to an infection fatality rate of 0.054. Now, all of these are just estimates, but look how similar they all are. This is quite impressive. And what this tells us is that the infection fatality rate, or how deadly the coronavirus is this year, is that it's certainly no more deadly than the common flu, and maybe, if these numbers hold, a little less deadly. And that's very, very important information. So, the prior slide showed us that if you get infected with COVID-19, there's a 99.95% probability you're going to be just fine. And there's going to be a 0.05% chance you'll die from that illness. Now let's look at something a little bit different. Let's look at the case fatality rate. Now, what a case is a person who has symptoms, presenting somewhere for care, having a test, and showing positive for the disease. We have a lot better numbers for cases because of that. And so what I've looked at is compared the flu of last year to what data we have for COVID-19. And I was able to find breakouts for specific ages in the number of years. The age groupings that I was able to find were not exactly similar between these two groups, so I've done some adjusting so we can have an apples to apples comparison. So what does this look like? For children ages 0 to 4, if they were infected with the flu last year, there was about a 1% chance they would die. For COVID-19, as of the date I looked, there had been no deaths in this age group. For age 5 to 17, again, about a 1% fatality rate for the flu and less than a 0.2% fatality rate for COVID-19. For the age group 18 to 49, 3.66% for the flu and less than 0.4% for COVID-19. For the age group 50 to 64, a fatality rate with the flu of about 5.8% and less than 3.6% for COVID-19. For the 65 and up group, the group that we worry the most about, the case fatality rate for the flu last year was around 9%, and it's less than 14.8%. When you break that out, we had data for COVID-19 that breaks it out into these age groups, which I did not have for the flu last year. We find that between the ages of 70-79, the case fatality rate was only 8%. And for the 80 and up, it was 14.8%. Now, because I don't have that data, it's quite probable that these numbers would be the same for this group, essentially saying that COVID-19 is certainly not more deadly than the common flu when we look at case fatality rates. And again, that's very, very important information. So hopefully some of you are asking yourself, so what's the big deal? Why did we blow up the economy and ruin my kids' graduation and our summer vacation for something that is no worse than the flu? Well, that's a good question. And it comes down to this issue, the infection rate, or what is called R naught. So R naught represents how many other people an infected person infects. So the R naught for the seasonal flu is about 1.3, meaning that when you catch the flu, you're going to infect about 1.3 other people on average. Well, a study came out on 4/13 estimating that the R naught for COVID-19 is 5.7. Now, that is 4.38 times more infectious than the seasonal flu. And it turns out that that's a big deal, as I'll explain further. So there have been other estimates of R naught previously, ranging from 0.5 to 4.5, but this may be the most accurate. But the verdict is still out, so we shall see. However, these next two graphs make it clear you do not have to be a rocket scientist to see that COVID-19 is much, much more infectious than the flu. This first graph looks at the flu over this season. On this axis, you see that it's looking at the number of positive specimens received, and it goes from 0 up to 25,000. Down here is weeks. So each bar represents the number of positive specimens in a week. And it goes from the 40th week of 2019 over to the 20th week of 2020. So as you look at this, you see that it peaks at about 22,000 positive case reported in these weeks, and then it drops off. Now let's look at the graph for COVID-19. First of all, notice that this axis goes from 0 to 40,000, not 25,000. And notice here, we're counting specific days, not weeks. So each bar here represents the number of cases presenting in one day, not in 7 days. And then look at the peak. The peak here shows values greater than 30,000 a day. So in essence, at its peak, COVID-19 has more cases in one day than the flu did in 7 days. That looks like 7 times more infectious to me. So why is COVID-19 more infectious than the flu? Well, we don't know for sure, but an adult with the flu is infectious 1 day before symptoms develop and up to 5 days after developing symptoms. But for COVID-19, there appears to be significant asymptomatic transmission for several days. Now, it is true that a significant number of people infected with the flu are asymptomatic, but may be less infectious. In summary, this presentation has shown the following. Based on our most recent data about the infection fatality rate of COVID-19, this virus is not more deadly than the common flu. An individual that becomes infected probably has a 99.95% chance of surviving the infection. Based on our understanding of R naught, COVID-19 is much more infectious than the common flu. Well, I hope you enjoyed this video and found it informative. If you did, please share it with somebody. And be safe.